Assalamu alaikum. Good morning. Please settle down. Let's start. Our discussion continues, and I'm sure you're relieved. This is the last session regarding parasites. I'm sure you're very relieved. Because the next sessions I have, we're going to be discussing on that. So the discussion continues along the same line like we had yesterday. So you're expected to be able to classify platforms that are of medical importance. You should be able to list the general characteristics of these ones, and you should be able to discuss the examples that we're going to have presented in terms of transmission and life cycle, in terms of diagnosis, prevention, and control. So the broad classification of Helminthes is into cystodes and trematodes. Now, this is an example of what a cystode looks like. So these are segmented platforms. So you have them made up of individual units. The trematodes are also referred to as the fruit, and they exist as just a single independent organism. They are not made up of units. Now, looking at this, what does this look like to you? Pardon me? No. As in, if you don't know anything about cystodes, you don't know anything about platforms. Pardon? An earthworm looks roundish. What does this look like? Just look at it. What tape? A tape measure. So that's why they're also referred to as a tapeworm. Okay? So if you see if you're able, if you're lucky to get the entire worm expelled, the treatment, then it looks something like that. So tapeworms are segmented platforms. So they have this ribbon-like body. If you look at the diagram, you can see that you have cross-partitioning to show you that the entire worm is not a continuous structure. So these units are referred to as proglottids for one or proglottids for many. The entire chain of this proglottid is referred to as the strobila. If you get the entire structure expelled in stool samples, we can also look at the head portion, which is usually the smallest part of the entire worm, and we can make a diagnosis of the type of species causing infection. The head has what we call suckers or grooves, depending on the species you are dealing with. These are essentially for attachment. Remember that the flatworms have a wider surface area available for food absorption, and that's why they don't really have a very developed GI tract. With the tapeworms, they lack a digestive system because they depend on pre-digested food from the host. Now, these worms are so adapted to the human host such that it is after they are done feeding on the nutrients that the host gets to absorb anything. Okay? And that's why these parasitic infections are devastating in poor countries, because you already have malnourished children, they're not eating enough, and now the worm is taking everything. The life cycle may be indirect or direct depending on the species you're dealing with. Clinically important cystodes include the tinea solium, which is the pock tapeworm, when it causes intestinal infection, or cysticercosis when it causes extraintestinal infection. Tinea saginata is the beef tapeworm, Dictylobothrum latum is a fish tapeworm. Hymenoleucus nana is a drug tapeworm of humans. Then you have Echinococcus granulosus and Multilocularis. Now, all these parasites indicated in red are the ones we're going to discuss. So let's start. Looking at this life cycle, how would you describe it? Why? There are two hosts. Which host is likely to be the definitive host? Why? Very good. So the conversation is going to be easy for me. An infected human being may shed either the eggs or the gravid proglotid in the stool. Now, these units that we refer to as proglotid, as they mature, they're sexually mature. Once mating takes place, because these organisms are hermaphrodites, they become packed full of eggs. So we refer to such proglotid as gravid proglotid. They are different from mature proglotid. Mature proglotid have well-formed sex organs, okay? But gravid proglotid already contains eggs. So that suggests fertilization has occurred and egg production has started. Now, these gravid proglotid can detach from the scrobila and they can crawl out through the anus. So at times, patients may bring proglotid to the clinic and we can use that to speciate, okay? At times, the proglotids get digested while still within the GI, and in that situation, we can pass out the eggs. So it's important to note that an infected individual may be shedding gravid proglotids or eggs in the stool, okay? What happens is that the gravid proglotids, if they are passed out in stool, they eventually rupture in the environment and release the eggs. Now, these eggs will contaminate the grazing site of the intermediate host. So the intermediate host is going to feed on the eggs. The eggs will give rise to the larval form of this tapeworm. This is very different from what we saw with ascaris and enterobius and all the agents we discussed yesterday. With those other agents, the larval form looks like the adult worm, right? You can see the structure and you can say this is a worm. But with tapeworm, the larval form is a cystic structure, okay? So this cystic structure is going to lodge in the striated muscle of the intermediate host. So how does humans get infected? When we eat the infected meat raw, there are some dishes in which you eat the meat raw, or we didn't cook it enough, okay? Then we will be consuming the viable larva stage of the tapeworm. Inside humans, this larva form will develop into the adult worm, okay? The adult worm, because they are hermaphrodites, will mature. The mature proglottids will start, mating, and then you have the gravid proglottids, and the entire cycle is repeated. Now, this is the usual life cycle for both Taenia saginata and Taenia solium. Okay, so you have eventually a GI infection. If you have a GI infection, what sample are you going to send to the lab? Stool sample, very good. Now, just a quick summary as regards Taenia saginata. We all agree that humans are the definitive host because the adult worm is found in humans. The intermediate hosts are the livestock, in this case, the cattle. The adult worms are found in the small intestine, and the infective stage is the oncosphere, which are the larva stages. Now, I said Diagnostic stages could be the eggs, the proglottids, or the adult worms, and we are going to discuss this in a moment. However, I want you to look at a tapeworm in its entirety. This is the complete tapeworm. You will notice that those subunits are referred to as proglottids. When it's very close to the head, they are very tiny structures. As you move away from the head, they become bigger, right? You can appreciate this. Now, as they become bigger, that's a sign of maturation. So the sex organs are maturing, so they are becoming larger. However, as you get towards the end, you can see that not only are they large, they are a little bit bulgy. So these are the gravid proglottids. I mean, if you see a pregnant woman, you know, you understand. So these are filled with eggs. So these are referred to as gravid. Those that are not bulging are referred to as matured, and those that look so tiny are the immature ones. Yes.
Is each proglotid its own organism, or are they all parts of one?
In terms of reproduction, the proglotid is a separate unit, reproductive unit, but it's a component of the entire organism. So you need all these proglottids to say that this is the tapeworm. Okay? Okay. Now the diagnostic stages could be the eggs, the proglottid, or the adult worm. And like I said, we're going to discuss that. In terms of transmission, we already know ingestion of the larva in raw or undercooked fish. And we already know the different types of proglottids that we can have. And we can explain what these terms mean, right? So if you send a stool sample to the lab, what are we looking out for? If we get the eggs, these are the eggs of Taenia species. Now, the eggs of Taenia saginata and Taenia solium are similar morphologically under the microscope, so we cannot differentiate. So if you see just the eggs, you can only say that the patient has tapeworm infection. You cannot say whether it's the pig or the beef tapeworm. Is that making sense? Now, what is so characteristic about the eggs? If you look at the inner structure, you will see these hooklets. I hope you can appreciate it. I'm trying to point it out. So you have these hooklets and you have a thick shell with striations that seems to be moving out, okay? So that's as far as the eggs go, and they need to be roundish, of course. I said the proglottids may also help in making a diagnosis. With Taenia saginata, the proglottids have what we call uterine branches. These black lines from the main vertical lines are the branches. So these are the branches. These are the uterine branches. This is the genital pore. So what we normally do in the lab is to introduce a dye through this genital pore to outline these branches. And then we count. So if you have like 15 to 30 uterine branches, that is highly suggestive of Taenia saginata species. And if you look at the gross proglottid, it is longer than it is wider. So if you compare the long axis to the transverse axis, longitudinal axis to the transverse axis, you find out that the longitudinal axis is longer than the transverse axis. So this is highly suggestive of Taenia saginata. If we get the head of the adult worm, we can also use this to make a diagnosis. These are the suckers we talked about. There are 2 pairs of suckers, and they are mainly for attachment. With Taenia saginata, a structure referred to as the rostellum is absent, as well as the hooklets. So the hooklets that we saw here don't persist in the adult worm of Taenia saginata. Is that clear? Now, Taenia solium deserves special mention. I know in Saudi Arabia, pork is not consumed. However, you may have expatriates coming in from regions where pork is consumed, and you can have a bizarre presentation. So it's important to know that with tinea solium, you can have both a GI, an intestinal infection, which we just discussed. It's similar to that of tinea saginata. Or you can have an extra intestinal infection, and that's the important one that you should take note of. Usually patients with cysticercosis can present with recent onset history of seizure disorder. So this is an adult who's never had seizure before in his life, and then in his adulthood, he starts to develop seizure disorder. You should include cysticercosis on your list of differentials. So that's why we are discussing this particular parasite. So the eggs of tinea solium, as well as the larva, are infected to humans. This is in sharp contrast to T. saginata, that is the one from beef. The one from beef, it's only the larva stage that is infected. As a result, it causes only intestinal infection. Now, what happens when humans ingest the eggs? If these eggs contaminate our food or water, then we become an accidental intermediate host. So the larva form is going to form as it would have in the pig. But in this case, it's forming in the human. And it can develop in different organs of the body. So you can have this larva form, which is referred to as cysticercus for one, cystisarchi for many. They can lodge in the brain, they can lodge in the eyes, they can lodge in the lungs, they can lodge in the liver. You can have them even in the bone marrow. Okay, we can have them in muscles, scalp muscles, and things like that.
Doctor?
Yes.
Can the cysts then travel from
Yes? No. We are dead end hosts, unless you are in a region where cannibalism is practiced. Okay, so we are essentially dead end hosts. So the patient will die with the, yes.
Humans are accidental and definitely.
Exactly. We are accidental when we have extra intestinal infection. And the route of transmission in that case is consumption of the eggs. We are definitive when we consume the larva form in the pork meat or the beef. In that case, we have intestinal infection. Yes, his hand was up before you, sir.
Once we have a test of infection, can it be transmitted from human to another human by fecal or route?
No, you need the intermediate host. You need the intermediate host, okay? The only way, if you have a patient, if we are discussing T. solium, which can cause extra intestinal infection, the only way the infection can pass on to another human is if you feed on the flesh of the infected individual.
The extra.
Exactly.
For the intestinal.
For the intestinal, you need the intermediate host for the larva stage to develop. Okay? Okay? Yes.
Can a person present with adult form and the cysticercosis?
I don't know. I don't know.
If their own food is contaminated by their own.
I guess in areas where you have heavy pig farming and things like that, it's possible, but I don't know. Okay. So how can you make a diagnosis? You can see that in this case, the samples that you can use to make a diagnosis is a little bit expensive. You can go beyond the stool because we know you can have extra intestinal infection. So if you send in the stool, if you're suspecting intestinal infection, again, the eggs, they are just like that of tinea saginata. So it's not enough to differentiate. You can only say this patient has tapeworm infection, and that's it. However, if you get the adult one, this elevation, which was not present in tinea saginata, is what we refer to as the rostellum. And you can see that there are hooklets on the rostellum. So this differentiates tinea solium from tinea saginata. Of course, you still have the succulent, and there are 4, but only 3 is shown in this diagram. Remember that the suckers are mainly for attachment. Now, if you get the proglotid, remember we said the uterine branches can be used to also make a diagnosis. With tinea solium, you have less than 15 uterine branches. As a rule of thumb, we always use 15 as the cutoff. So if it's above 15, it's tinea saginata. Below 15, it's tinea solium. Okay. And you can see that the longitudinal axis is very similar to the transverse. So you have like a square structure. You can also send in blood for serology because you can have these extraintestinal infections. The larva form has antigens that the body can respond to. Imaging studies may also help. For example, I told you if the patient is an adult and the person is presenting for the first time in his or her life with seizure disorder, you may want to rule out cystic So you can send them for imaging studies, and all these whitish specks you can see in this brain is the larva form of the worm. You can also have calcification of the cystosarcide in muscles, striated muscles. So you may use imaging studies to assist you in diagnosis. We move on to Echinococcus granulosus. Now this tapeworm is the tapeworm of dogs. Dogs are the definitive host. So the usual life cycle involves an infected dog passing out the eggs in the environment. These eggs will now get to the grazing site of the intermediate host, usually herbivores such as sheep and goats. And in this intermediate host, you're going to have the oncospheres or the larval form of these parasites forming in internal organs as well as muscles of the intermediate host. So if the dog now feeds on an infected intermediate host, particularly on internal organs such as the liver, such as the lungs, the GI, then these larva forms are ingested and they develop into the adult worm. Once the adult worm forms, the dog starts to pass the eggs again in feces and the cycle continues. So this is the usual cycle shown in red. However, just like the eggs of tinea solium, the eggs of Echinococcus granulosus can also cause infection in humans. But again, they are dead-end hosts. They are accidental. Unless you feed the human body to a dog, this is the end of the story in humans. Are you following? Just like with the hydatid, just like with the cystosarcide, you can have these hydatid cysts. That's the name for the larval form. You can have them in different organs of the body. You can have them in the brain, you can have them in the lungs, the liver, all over, okay? So as a summary, with Echinococcus, there are certain things you should note. Humans are not the usual definitive host, so it's the dogs. However, because the eggs are also infective to humans, we can become accidental intermediate hosts or dead-end hosts. Now remember, the life cycle ends in humans because if you don't feed human body to the dog, that's the end. Okay, so that's why we're dead-end. The usual intermediate hosts are the herbivores. They are found in the small intestine of dogs, the adult worms. The infective stage to the definitive host is the larval form, whereas the eggs are the infective stage to humans. I hope you're getting the difference. The diagnostic stage, because we are not interested, we are human doctors, we are not vet doctors, so we are not looking out for the eggs. The eggs will not be present in humans anyway. So the diagnostic stage in humans is the hydatid cyst. This is the name for the larva form. The mode of transmission for the definitive route is the consumption of the larvae in the sheep or in the goat. But in humans, it's the ingestion of the eggs that will establish infection. Are you following?
Yeah.
So that's why I put some of this in red to emphasize what you should take note of. Human echinococcosis, which is also referred to as hydatidosis or hydatid disease, is caused by the larva stage of the cystode of the genus Echinococcus. So there are different species. You have Echinococcus granulosus and multilocularis. And the hydatid disease that results are different. You tend to have unilocular disease with Echinococcus granulosus, and you tend to have multilocular disease with Echinococcus multilocularis. So Echinococcus multilocularis is a little bit more virulent than granulosus. Echinococcus granulosus is composed of the scarlet and only 3 proglottids. This is very interesting because we can use this to teach students. So when we talk of immature, mature, gravid proglottids, you have everything on one slide. Okay? So how can you make a diagnosis? Now, unlike the other tapeworms we discussed where the microbiology lab plays a role, the microbiology lab is not actively involved in the diagnosis of this condition. Okay? So different approaches to diagnosis, you can use immunodiagnosis, in which you have intradermal application of antigens associated with the larva stage. You can perform serology using ELISA. Imaging studies may help, and histology. This is very important because Dr. Abra shared with us his experience with a patient that he managed with a physician. The lady presented with breast mass, and they thought it was a malignant condition. So she had excisional biopsy done, but under histology, they found out that it was Echinococcus. They were hydatid cysts. So this just to buttress the fact that this cyst may lodge in any organ or tissue in the body. So how can we prevent infection? Regarding cystodes, we know that it's the consumption of the larva stage that will establish infection in humans. So proper and thorough cooking of meat. Now let me further clarify this. In developed countries, once you see that the meat is infected, they're referred to as measly beef. You can actually see the cystic lesions with the naked eye. What they do is they discard it, it's destroyed. But in areas where you have endemicity of this parasite, these are usually poor regions of the world. So they may not have that luxury of discarding the meat. You understand? So they have to cook thoroughly to make sure that they kill the larva. At least you must cook the food up to 65 degrees centigrade. That's enough to destroy the larva stage. Now you should avoid contamination of grazing sites of livestock. So people should have proper waste disposal facilities. You should not feed animal offals to dogs. This is with reference to Echinococcus species, because we know that the larva form is present in the herbivores. So when we say offals, we are referring to internal organs such as liver, such as lungs. There should be adequate treatment of an index patient when you're dealing with senior species, because once you treat the index patient, he or she will stop shedding the eggs in the feces, okay? And there should be health education to discourage people from defecating in the environment. Let's move on to the trematodes. The trematodes are non-segmented flatworms. Okay, so they don't have probiotics. The exception to this appearance are the schistosomes. The schistosomes exist as male and female worms, although they are fixed. Humans are the definitive host for trematodes. Intermediate hosts include freshwater snails for the schistosomes. However, for some other species, but because we are not discussing them, I've not listed them. But I think it's important you know that freshwater fruits and plants may also act as intermediate hosts for some trematodes. Now, unlike the cystodes, they have incomplete digestive system. So you have the ventral and the oral suckers. So the ventral is for attachment and the oral is for feeding. Like all cystodes, like all platyhelminths, they are hermaphrodites, except the schistosome species in which you have the male worm and the female worm. So the schistosomes are the exception to the general characteristics of trematodes. Now, the mode of transmission depends on the type of trematode you're dealing with. So you can have penetration of intact skin, or you can have ingestion of the larva stages, either in freshwater plants, or in fish, or in crabs. For most trematodes, the eggs tend to have a lid. This is the opening through which the larva stage will escape through once the eggs have access to water. The exception are the schistosomes. They tend to have what we call spines, and you're going to see that in a moment. They tend to have indirect life cycle, requiring one or more intermediate hosts, depending on the species you are dealing with. The life cycle could be sexual, so you have sexual reproduction in humans and asexual reproduction in freshwater snails, when we are discussing schistosomes. Now, clinically important trematodes are listed here. We are only going to discuss hematobium and Mansonia in this discussion. However, I want you to note that different tissues may be invaded by different hookworms. For example, Phaseolopsis boschi is found in the large intestine. Fasciola hepatica, from the name hepatica, you know it has a predilection for the liver. Clonoiches sinensis also invades the liver and is associated with malignancies of the liver and the gallbladder. Paragonimus westermanni is associated with the lungs. So from this, you can see that the samples that can be sent to the lab to aid the diagnosis of parasitic infection can be quite varied. For example, with Fasciola boschi, what sample do you think you're going to send? So with Fasciola hepatica, you won't get bile, but what happens to bile? It eventually, yeah, so stool, or you can send in a biopsy sample. With Clonoiches, similar to Fasciola, with Paragonimus westermanni, what are you going to send? Very good. So you can see different parasites, different samples that can aid in the diagnosis. So that's why I've listed these names. So I don't really expect you to learn the names, but I expect you to remember that different samples can aid in the diagnosis of parasitic infection. Is that clear? So with schistosomes, we are going to focus on schistosoma hematobium and Mansonia. From this diagram, how would you describe the life cycle? Very good, because we have the snails as the intermediate species and humans as the definitive host. Why do we say humans are the definitive host? The adult forms are fine. Very good. So the life cycle starts when humans go swimming in rivers, freshwater rivers, lakes, streams, that contains the secarium, which is the larva stage that is infected to humans. Just like the filariform stage of hookworm that can penetrate intact skin. The Secariae are also able to penetrate intact skin. The moment they penetrate through the skin, they are going to change from being motile to non-motile, forming the schistomoles or the schistomula. The schistomula eventually migrates to the blood vessel associated with that particular species of schistosome. Now, for Schistosoma mansoni and Schistosoma japonicum, the adult ones tend to be found in the mesenteric blood vessels, the vessels that supply the GI. With Schistosoma hematobium, they tend to go for the cervical plexus that supplies the urinary bladder. Are you following? From that description, what samples do you think you can send to the lab to aid the diagnosis of Mansoni? Mansoni, I said. Two, why? They are found in the mesenteric vessels. Okay. So when these adult worms, when the adult worms mature, the female will start producing eggs and the male will fertilize the eggs. Now these eggs are motile. So for those that lodge in the mesenteric vessel, the eggs may find their way either into the liver, the gallbladder, or into the intestine. Are you following? That's why stool samples can help you to make a diagnosis. For Schistosoma hematobium, they are found in the cervical plexus. So the eggs, when they move, they get into the bladder. So you can send urine sample to the lab. Yes.
But isn't Schistosoma mansoni the vein? The right?
Yes.
How does it lay eggs in the?
No, it's not laying eggs in the intestine.
How is it?
The eggs are produced right there in the vessels, but they find their way. The eggs are motile. The eggs are motile.
And they go to the.
Now let me ask you a question. We agree that Schistosoma mansoni stool sample is the best sample to send to the lab, right, to make a diagnosis. Now, if we send a urine sample to the lab and we can see S. mansoni A, what do you think? Just hazard a guess. There's no catch in the question. What do you think? Could be a fistula, I agree. What else? If I tell you, I'm trying, yes. Spread from where to where?
Through the whole system.
Maybe not. Thank you. Please, can you repeat yourself? Yeah, it shows there's fecal contamination of the urine sample. Or there may be an abnormal connection somewhere along the line. So anyway, that's just by the way. So the adult ones will produce the eggs. The eggs will eventually find their way to either the GI or the urine. And then when you have the infected person going to the river or stream and defecating or urinating close to that body of water, these eggs are passed out in the urine or the stool. In the environment, the miracidium, which is motile, will emerge from the eggs. This miracidium will actively seek out the snail intermediate host. And these snails are usually present because you have vegetation by this body of water. The snails are feeding on the vegetation, but the miracidium is going to invade and start developing in these snails. Another thing I want you to note on this diagram is the fact that you have different snails represented here. This is because different snail species can support different schistosome species. But I'm not going to bother you with their names. I just want you to know that the snail species is specific for the schistosome species. Okay? So in the appropriate intermediate host. The miracidium is going to develop further until it eventually becomes the Secaria. The Secaria are present in the water. So if somebody comes swimming or wading through, the entire process is set into motion again. Exactly. So what do we look out for in the lab? There are certain diagnostic features of the eggs when we see them that we look out for. You can note that here, the eggs have smooth shells, okay? They all have smooth shells. However, you can see these projections or protrusions, okay? Now, excuse me, the location of these protrusions is diagnostic. It can give us an idea of the species of organisms that we are dealing with. With Schistosoma hematobium, which is this one that I'm pointing to, the spine is located at one end of the egg. So we refer to this as terminal spine. Remember, we said they don't have operculum. Okay? So the terminal spine is diagnostic of Schistosoma hematobium. The one in the middle is Schistosoma japanicum. Here, you can see that the spine is almost rudimentary. I'm sure if I didn't point it out to you, you may think, oh, it doesn't exist, right? So it's very small and it is to the side. So it's not at one end of the egg, it's at the side of the egg. So this is the lateral spine that is small. This is diagnostic of S. japanicum. Are you following? The last egg, as you can see, has the spine again to the side, but it's very large. So this is Schistosoma mansoni egg. So when we see these structures, we can make a diagnosis. So in terms of prevention and control, with schistosomes, again, proper disposal of human waste cannot be overemphasized because we keep on burdening the environment with the infective form or the eggs that we eventually develop into the infective form. We can eradicate the snail host either by clearing the vegetation that they feed on or by using chemical agents that can kill the snail. You should warn people to stay away from contaminated freshwater lakes and rivers. Discourage people from swimming in these areas. Health education is also very important. Present early treatment. There are drugs that can treat infection before complications set in. Any questions?
Thank you.
I think we have to take the attendance again just to be fair to those who came in just about the time I was starting. Okay. Yes.
What's the treatment?
For
Treatment.
we normally use praziquantel, but I don't want to say much because Dr. Hatuk is coming to discuss that.
Head start.
Pardon?
Head start.
What did you say?
Head start for the lecture.
Let's start.
Head start.
Yeah.
Oh, okay. No. She will discuss that with you. I know she will. So the next two lectures I have with you. Yeah, that reminds me. The last time I was discussing with the ladies, they agreed that I can put up some questions for discussion. So I promised them that I will do that. And I'll also share the links to the YouTube